This is our health and fitness segment. This is the moment in the show where we try to bring you some insight into how the food you eat and the things you drink and the activities you do.
A shot of reality this morning.
Right. How those things, fare on your health. And we are, I'm sure you've seen the headlines. It's all over the place over the last couple of days. A new study that has come out regarding alcohol's link, the consumption of alcohol, and the link to your chances of dying from cancer, not just getting cancer, but dying from cancer. Dr. David Nelson is the director of the Cancer Prevention Fellowship Program at the National Cancer Institute there in Bethesda, Maryland, and joins us on the phone right now. He's the author of this study everyone's talking about. Good morning, doctor.
Good morning.
So, were you a little surprised at how this story has really grabbed people's attention almost instantly?
Well, I'm actually glad that people are paying attention because that was one of the things we hoped would come out of the study.
Right, and I think as I believe you've been quoted as saying, people don't like to talk about this link.
Yes, and for whatever reason that might be, it's actually not something that's new. We've actually known for several decades that alcohol as a compound is a known cause of human cancer. We just hadn't had any estimates about what the impact was in the United States in about 30 years.
So, doctor, can you tell us, is alcohol linked to specific types of cancer, or are you speaking cancer in general?
Specific types of cancer. What we did was we looked at the cancers in which there was clear consensus among scientists that there is a link between alcohol and cancer risk, and those are cancers of the mouth and throat, cancers of the esophagus and the liver, the breast, and the colon and rectum.
And so you say 30 years since any sort of updated research information on this topic. That seems like a long time for this not to be studied.
So actually what's happened is it's been studied for a long time and a lot of information has come out. There's not been an estimate for what the impact is on the United States population as a whole in 30 years.
Right.
And so while it was known in the medical research community, is it just something that the public has not been aware of? Is that more accurate?
Well, I think both are accurate, actually. I think that there has been a lot of work on specific types of cancer and these risks, so there's some knowledge about that, but I don't know that it's been heavily broadcast, even in the healthcare world, so which means, of course, it's not more broadly known in the public either.
I think the portion of the study that grabbed my attention right away was the fact that this effect is not just for people who are heavy drinkers. Even moderate drinkers, you say. There is no, do I understand this correctly? There is no safe level of alcohol consumption according to your study?
When it comes to cancer, we don't know what the safe level is. I do want to point out that clearly people who are regular, heavier drinkers are going to be at much higher risk for developing cancer than people who are lighter drinkers. But we also know there are a lot of people who drink at light and moderate levels, and so that they are also at risk as well.
So I noticed that there is a link, and you mentioned it with breast cancer. Is this something, if a woman is concerned, maybe she has a family history or, something that would make her more concerned about her chance for breast cancer, would you say this is the person who should back off alcohol a little bit?
Well, I think anybody concerned about breast cancer should really think about alcohol and whether it's something that they want to take and consider using, because we do know that there is an increased risk. This has been quite well studied over the past 20 years or so. So it's a strategy that somebody who is quite concerned about breast cancer certainly can apply, which is those who choose to drink can choose to drink less, and obviously the lowest risk would be among people who don't drink at all from an alcohol perspective.
So sometimes we feel like we can't control what about our life may put us at risk for cancer because there's so much unknown about it. But this is a controllable thing. You can say, well, I can choose to do less alcohol, and that's like a choice that I know I'm helping myself.
Like smoking. You can
choosing to quit smoking.
Yeah.
Absolutely.
So we're speaking with Dr. David Nelson. He's the director of the Cancer Prevention Fellowship Program at the National Cancer Institute in Bethesda, Maryland, author of the study that's in the headlines right now regarding alcohol consumption and its link to cancer. We know that if you do it, it is going to increase your risk, but we don't know the why. Is that right, Doctor?
Well, we don't know exactly what the reason is, and that's because although there are several hypothesized ways, and I don't want to get into science talk here for you about how it works at the cellular level. There are a number of theories about how it acts. We don't know exactly what it is for each type of cancer. So different speculations and different types of studies. One of the challenges in alcohol research in cancer is that there really isn't an animal model. So it's not something you can easily study on lab mice or something like that.
Are there a couple of front runners, though, when it comes to the why? At least like speculative?
Well, there are a couple of things. One of them in the area of the combination of tobacco and alcohol use, which certainly increases the risks of mouth, throat, and esophageal cancer. That one of the things can be that the way that tobacco products are broken down also helps the alcohol act as a carcinogenic agent or something that helps cause cancer. There are some thoughts about one of the compounds when you consume alcohol. A byproduct is something called acetaldehyde. And I don't want to get into the chemical parts of these things, but we do know that particular compound also is a known, it breaks down into a agent that can cause cancer. So that's another one of the major theories.
Because one of the things that I always wonder whenever I hear when a test comes out is, did you have a chance to look at how people who might be moderate to heavy drinkers, the other lifestyle factors that would be in their life that would also contribute to, cancer risks and that sort of thing?
Right. And so what we did for the study, which is looked at a number of different data sources, is we took some studies where they looked at large numbers of studies over populations over the course of time, where they actually control for those factors. And so that's controlled in our analyses. So they do look at issues, for example, like smoking behavior and other things. So we're pretty confident that the numbers are about as accurate as we can get.
Yeah.
So you isolated out the alcohol factor and accounted for other lifestyle factors that could be impacting the outcome.
So I'll put my science hat on here.
Okay.
And I apologize
That's okay.
So
That's okay.
There's something called meta-analysis, where what happens is it's not one study, but you combine a bunch of studies that a bunch of different researchers have done.
Uh-huh.
And so we used estimates from those meta-analyses in our calculations.
I see.
Okay, so I'm just reading a couple of little highlights from the study. This is off of the article written in sfgate.com. So people who drink more than 3 alcoholic beverages a day are in the higher risk group, but then somebody who may have less, like 1.5 drinks a day, is still at a pretty significant risk. I think for some people, they would consider just a drink or so a day wouldn't really be that alarming.
And we've actually we've had studies on this very show that indicate that like 1 drink a day might be better for your heart health.
Right.
So I guess you're sort of balancing
conflicting
things.
information.
Yeah.
Right. So I think that is confusing for a lot of people, and understandably so. So I will point out that I'm a cancer researcher. That's my area, and cancer prevention is what I do. And I know that there have been some studies out there about cardiovascular health. I do want to point out that those seem to get a lot of press and a lot of attention.
They do.
Because they're...
Yeah,
because it's what we want to hear.
Yes.
Well, you took the words right out of my mouth. I remember a few years ago stating that I was waiting for the first studies to come out about chocolate and chocolate being good for us. And I was so pleased when that actually happened. And then when I got below the surface and found out that the studies were fairly small, some funded by the chocolate manufacturers.
Right.
And not the milk chocolate that I loved so well, but something else. So,
Always, right?
Yes, not quite so simple.
Dr. David Nelson, the director of the Cancer Prevention Fellowship Program at the National Cancer Institute in Bethesda, Maryland. Thanks for joining us this morning.
Okay, thank you.